This is my 22.2 exercise prescriptions. So an exercise prescription is basically a plan that is developed by a fitness trainer or rehabilitation specialist, and they make a plan that is specific to you and say your injury or your condition, and it's made up of fitness related activities made for a specific purpose to help you get back to what you want to be, or to help you get to an end goal, or something like that. So contraindications, one of the two. A contraindication is a specific situation in which drug, procedure or surgery should not be used because it may be harmful to the person. So there are two contraindications. They're absolute and relative. So absolute means that any surgery or procedures or substance that you take or have could cause a life-threatening situation. So a procedure or medicine that falls into this category must be avoided at all times. So something is going to happen if you take this route. So for example, if someone has had a history of a recent heart attack or has had severe infections or fever, then you should avoid it at all times, because there is a very high risk that could come back and it could cause the worst case death. So relative contraindications are conditions where caution should be used when two drugs or procedures are used together. So for relative ones, you can use drugs and procedures together, but it's only acceptable if benefits outweigh the risks. So, for example, you would take extra caution in advanced pregnancy or liver diseases or high blood pressure, as there is a chance that something could go wrong. However, if a procedure or medication outweighs the risks of it, then it's something that can be done. So the first one, people I'm going to talk about, is obesity or obese people. So some contraindications of these might be type 2 diabetes, coronary heart disease or hypertension. Type 2 diabetes, exercise is very important as it helps you to keep control of blood sugar levels, and the exercise will help to keep the heart healthy and stronger, which will then help to maintain good cholesterol, which then avoids arteriosclerosis, which people with diabetes are more susceptible to than others. Coronary heart disease, exercise can help to reduce high blood pressure, high cholesterol and obesity, and all of these are factors of coronary heart disease. Hypertension, so exercise can help to lower blood pressure, and people with hypertension should avoid caffeine 3 to 4 hours before exercising, as it may cause a spike in the blood pressure, which it wouldn't be very good for them. So the prescription for this, I would say frequency 5 times a week, maybe 6 if they can. It really depends how obese they are. So some people may not be able to exercise 5 times a week. Some people may have to cut it down, whereas others, if they've been doing it for a while, will be able to exercise more. So the intensity should be low to moderate. You should slowly build up the intensity, but if the participant feels any discomfort, especially in the heart, then they should stop immediately or take it right down. The time, I would say 30 minutes each time. So you can either do it all in one bout or in 2 or 3. So they could do 3 lots of 10 minutes or 2 lots of 15 minutes. So the types, I would say aerobic, so cycling on the indoor bikes, or walking on the treadmill, as this is meant to be very good for weight loss, especially if you do 10-minute of kind of moderate walk on the treadmill or cycle. So, however, you need to avoid anaerobic sprints, especially for coronary heart disease, as it will put a lot of strain on the heart. Avoid exercising after a large meal. Also avoid if weather is too hot or too cold, at high intensity, or sudden changes in level or speed, as their body is not used to it. So the next one is elderly people. So contraindications could be osteoporosis, hypertension, or that's meant to say arthritis. Oops. So for arthritis, or let's start with osteoporosis, exercise will help to strengthen the muscles, but also improves overall bone strength and health. And depending on the severity, it is important to do some weight-bearing exercise, such as walking, but this will need to be built up over time. But doing this walking will help to build and maintain bone density. Hypertension we've already talked about on the slide before, and arthritis. So exercise helps to limit the pain and maintain the mobility and range of motion. And it does this by keeping the muscles strong, which support your joints, which can prevent disability in the long run. So the prescription for this, 5 to 6 times a week at low intensity, but for 20 to 30 minutes. So even going out for a 10-minute walk for 3 times a day will start to help. The type of it should be aerobic or non-weight bearing. So like swimming and cycling is good for osteoporosis if it's like too painful for them to do actual weight-bearing activities such as walking, swimming and cycling will be good for that. You'd have to avoid high-impact exercises, rapid movements, bending and twisting, or high intensity, especially with hypertension. So the last one I'm going to talk about is pregnant women. So contraindications to this are low blood pressure, reduced range of movement, motion or flexibility, and muscle weaknesses. So low blood pressure, you should avoid exercise where your head is lifted suddenly from below the heart, because this sudden change in posture can bring on symptoms such as feeling faint or dizzy. Start exercise slowly and then build it up. And if you're doing any kind of stretching on the floor, like either sitting or lying down, then to get up slowly, as it can make you feel very dizzy if you get up quickly. So reduce range of motion. It depends how far they are into the pregnancy. The range of motion will be different. So obviously if you're later on in the pregnancy, then the range of motion will be much less. And to improve range of motion, different stretches are normally used. However, you don't want to overstretch. And muscle weaknesses, add strength training exercises into the session. However, if you're heavily pregnant, don't lift heavy weights or any weights near the end, as that's not advised. And if you are strength training, make sure you have rest days included to allow muscles to recover. So frequency for this, I would say 3 to 4 times a week at low to moderate exercise, as these 3 to 4 times can give you then the ability to exercise and then have a rest day afterwards, so allow your muscles to then recover. Low to moderate exercise depending on what you feel comfortable with. If there is any discomfort though, stop. 30 minutes sessions, and stuff like Pilates or yoga or swimming. So that's depending on how far along in pregnancy. But swimming is good exercise when pregnant, as the water helps to support the extra weight. And with yoga, they should avoid poses like from seated to standing, but poses involving twisting are fine. And you should avoid exercise if you have medical conditions such as like asthma or heart disease, like put that in your family. And if you've had previous premature births or history or early labour.